For first responders, going to work can mean close encounters with dangerous or disturbing situations. To help us understand what that's like and how people deal with work-related trauma, I'm joined by Katy Kamkar in Winnipeg. Katy is a clinical psychologist at the Centre for Addiction and Mental Health in Ontario. She is also the director of Badge of Life Canada. That's a charitable organization that works with first responders who are dealing with psychological injuries. Katy, what are the biggest challenges when treating first responders who have been through traumatic experiences, especially when the other first responders, people they know and have worked with, have been killed?
Yes, you're right. I mean, first of all, the news today, absolutely devastating, very sad. And so, yes, right now, even though I do reside in Toronto right now, I'm in Winnipeg for the Canadian Association for Police Governance, and everyone is very deeply saddened. It's very true. The trauma is very real. We're talking about a variety of traumas. Certainly, we're also talking about accumulation of traumas. So to experience stress or dealing with symptoms of depression, symptoms of anxiety, post-traumatic stress, at times or elements of burnout, can actually all be very real.
Okay, what are the symptoms?
Variety of symptoms. Certainly, when we hear about the terrible losses today, dealing with grief and mourning are very common. So in terms of normal emotional reactions, sadness, feelings of anger, it could also be shock and denial, variety of emotional reactions that we can go through. But generally, in terms of when we talk about symptoms of post-traumatic stress or also very common symptoms of depression, often we are dealing with distressing, intrusive memories. Also, it could be bad dreams related to the traumas, flashbacks, so a sense of reliving the incidents, and also avoidance. It could be avoidance of anything that can remind us of the traumatic incidents. Difficulty with our sleep, difficulty with our concentrations, can also be mood irritability, feelings of anger, hypervigilance, or feeling excessively jumpy. Difficulty also functioning in our day-to-day activities, any activities, responsibilities within our work, personal life. So it can tremendously affect our day-to-day life.
Can you give us an anonymous example of one of the more severe cases of post-traumatic stress, this kind of trauma that you've dealt with?
Well, I'm not sure, about what I would call, let's say, one of the worst, because there's so many significant individual differences. And at times also, it's not always necessarily the trauma per se that can be the direct predictor of the severity of the symptoms. It could also be a variety of other factors and events and issues that could lead to also be significant contributors to severity of psychological symptoms and subsequently impair our functioning and day-to-day activities and responsibilities. But certainly events where there is a personal resemblance, there is a personal connection, events that are interpersonal, oriented, interpersonal violence, also events involving children are tremendously traumatic and can be very difficult.
I would imagine it would be very difficult for people who worked closely, who witnessed either the event itself or the aftermath of it. I would imagine that, especially if you are a trained police officer or someone who's been trained to help in some way, that you would maybe take on some guilt and say, what could I have done differently?
You're absolutely right. And I think we do refer to this as vicarious trauma. So a lot of times, it's the repeated exposure to trauma or being exposed to the aversive details of the traumatic event can make us definitely vulnerable to symptoms of post-trauma. Certainly witnessing, and as you said, with related symptoms of sadness, anxiety, and also guilt in terms of, as you said, what if this and what if that and what else could I have done, can certainly create a lot of psychological distress, and it's also very real. Absolutely.
What is the best way to prevent these symptoms from getting a hold of you?
Thank you for asking for that. It's very important to know. I mean, of course, we always talk about prevention. Prevention also works on a continuum level, certainly gaining awareness in terms of what are common signs of symptoms that I need to know. Of course, if we know that the signs and symptoms create more distress over time and interfere with our functioning and activities, it's very important to seek help, especially if we see that after week after week after a month, we are not getting better and we are feeling worse. It's very important to seek help. Certainly, initially, peer support, seeking support with our loved ones, close friends, and family members can be very helpful. Self-care is tremendously helpful. Of course, we always recommend proper sleep and a work-life balance and healthy diet and exercise, quality social support. And of course, if over time we feel that we are getting worse, professional help is important to seek help. And it's important to know not to suffer in silence. And we do have effective treatment available. It does work. So it's very important to seek help when and if we need it.
Essentially, what is that treatment?
Well, for example, we have trauma-focused evidence-based treatment. We have trauma-focused evidence-based cognitive behavioral therapy, for instance. So it's based on a lot of psychoeducation to gain more awareness in terms of signs and symptoms that we are experiencing, and a variety of skills and strategies to reduce, for instance, here as we talked about, re-experiencing symptoms of trauma, a variety of other strategies to improve our function, helping us to reduce any unhealthy coping or unhealthy avoidance. We also know that with trauma, it shatters often our belief system, our belief about sense of self, our views about ourselves, views about others and the world. And so in CBT, cognitive behavior therapy, we also very much target the change in our belief system and how to cope healthier way, more efficiently, so that we can move gradually forward and build further our resiliency. So it's really how can I bounce back and take graduated steps to move forward and further build my resiliency.
Katy Kamkar in Winnipeg, thank you for joining us tonight. Katy is a clinical
Thank you very much for having me.
Katy is a clinical psychologist at the Centre for Addiction and Mental Health in Ontario. We'll be right back.